Hi, uh, good evening, and welcome back to this histology slide discussion sessions that we have every Thursday. We are back with three more important slides which belong to general histology, and we'll be talking about the histology of blood vessels today. And in histology of blood vessels, we get three major slides for discussion, and let's try to dissect each slide one by one. The first slide that we see, right? This is the slide of the large sized artery. We will see all slides at once and then we will take up each slide individually. This is a slide of large sized artery or elastic artery. This is the slide of muscular artery or medium sized artery. And this is the slide of large sized vein. So large sized vein, medium sized artery, large sized artery. Fine. So let's start our discussion with the histology of the large sized artery, otherwise commonly referred to as the elastic artery. Right? Now, what layers actually make up the blood vessel? Remember, a blood vessel is made up of the tunica intima, then we have tunica media, and then we have tunica adventitia. So each blood vessel is made up of three layers. And what are they? One is tunica intima, right? The second one is tunica media, and the third one is tunica adventitia. So these are the three layers of any blood vessel. Let it be an artery, let it be a vein, a large sized artery, a medium sized artery, anything, right? Now, let's talk about each of the layers. First, let's talk about the first layer, which is the tunica intima, right? Now remember, this tunica intima is made up of three sublayers again. We have the endothelium, we have the subendothelial connective tissue, and then we have something referred to as the internal elastic lamina. Right? Now, each tunica intima, let it be a medium-sized artery, a large-sized artery, or a vein, will contain all these three layers. Endothelium, as we know, is simple squamous epithelium lining the blood vessel. Deep to this, there is a thin layer of connective tissue, which is separated by the tunica media by a layer of elastic tissue or lamellae, which we refer to as internal elastic lamina. Of course, in a large sized artery or elastic artery, this is not prominent because the substance of the media and that of the internal elastic lamina is almost the same, right? So let's imagine this slide is there in your histology exam. How will you go about describing this? So this is the slide of the large size artery or elastic artery. The next question from the examiner would be, how do you say it? So I can see three layers: tunica intima, tunica media, and tunica adventitia. The tunica media appears to be the thickest layer in the entire three layers or three tunics. And this thick tunica media is made up of elastic lamellae. That is why I say that this is the slide of elastic artery or large sized artery. Now the examiner will ask you, explain the histology of large sized artery. Now how do we do it? Remember, just a minute. Yeah. How do we do it? Large sized artery will contain tunica intima as the innermost layer, which is made up of three sublayers: the endothelium, subendothelial connective tissue, and internal elastic lamina. Deep to this, thin layer of subendothelial connective tissue. This is separated from the tunica media by a thin layer, which is referred to as internal elastic lamina. Deep to the internal elastic lamina lies a thick tunica media, which is made up of 50 to 60 layers of elastic lamellae. Because of this, the artery can stretch and recoil. Stretch, recoil. So your aorta is one of the best example for large size artery. Done? So this is how we start describing the structure. Now, what about tunica adventitia? Remember, tunica adventitia is made up of connective tissue This contains the connective tissue which supports the tunica media, as well as two structures called as, one is called as vasa vasorum. Vasa vasorum, and the second one we refer it to as nervi vasorum. Done. What is vasa vasorum and nervi vasorum? Vasa vasorum is a blood vessel supplying the blood vessel. Nervi vasorum is a nerve supplying the blood vessel, and these are located in tunica adventitia. So how do we say that this is large size artery or elastic artery? Thick tunica media. This should be the giveaway point, right? Invariably, you will not see the entire lumen when they focus a large size artery. Remember, this is a 10x view, and you will not be able to see the complete lumen. Now let's compare this with the slide of the medium sized artery. Now a larger lumen can be seen. Now take a look at the tunica media and take a look at the tunica adventitia. So the tunica media is almost equal to tunica adventitia. Now what is this artery? This is the medium sized artery, also referred to as the muscular artery. Why do we call it as muscular artery? The tunica media is made up of smooth muscles and very few elastic lamellae. Large size artery have the ability of recoil. These provide resistance. So medium sized artery is the best example we can think of as your radial artery, your ulnar artery, your palmar arterial arteries. All these are medium sized arteries or muscular arteries. Rest of the structure remains the same. The endothelium has the same thing. Endothelium, then subendothelial connective tissue. But if we enlarge this, can you see this prominent layer? Now this wavy layer is what we refer to as the internal elastic lamina. Right? Now internal elastic lamina is very prominent in medium sized artery or muscular artery. Your examiner will definitely ask you, why is this? Your answer should be, in case of medium sized artery or muscular artery, the internal elastic lamina stands out because the media is made up of smooth muscles, and the elastic fibers in the internal elastic lamina will stand out very distinctly. Whereas in case of large sized artery, the composition of the tunica media and the composition of the internal elastic lamina both are almost the same. Are we clear with this? This is regarding the structure of medium sized artery or muscular artery. Done? Right. Then the third slide of blood vessel is this. Now what is this? This is a large sized vein. Now, how do we identify this slide? Remember, the large sized vein will have a collapsed lumen. So this is the lumen. Then again, we have tunica intima. Then this is the tunica media. But the peculiar feature here is thick tunica adventitia. So remember, what happens here is the tunica adventitia is more thicker than tunica media. Now the big question is why? Forget about tunica intima because the structure is the same. Endothelium, subendothelial connective tissue, and internal elastic lamina. Done. Now, what about the tunica media? The tunica media contains smooth muscles similar to muscular arteries. But the peculiar feature of a large sized vein is this tunica adventitia. And as we can see longitudinal bundles of smooth muscles located within the tunica adventitia. This actually tells us the slide that we are looking at is the large sized vein. So what is the characteristic feature? Presence of longitudinal bundles of smooth muscles in the tunica adventitia. Now, what is the function of this? Remember, what is the function of a vein? Veins basically, when they contract, they push the column of the blood upwards. Now, how they can push the column of the blood? They have muscles in their walls, and when these muscles contract, the blood is pushed up. So muscles in the tunica media themselves are not enough. The muscles in the tunica adventitia is what which will push the blood upwards. Right? Are we clear? So, what are the three layers of a large-sized vein? Tunica intima, tunica media, tunica adventitia. Tunica intima similar to an artery. Tunica, then we have tunica media similar to a muscular artery where we have the smooth muscle layers. But what is the most peculiar feature? The tunica adventitia. Tunica adventitia, remember, is the thickest layer that we will see in a large-sized vein. How did we identify the medium-sized artery or muscular artery? The tunica media and tunica adventitia both are of same thickness. How did we identify large-sized artery or elastic artery? The tunica media was the thickest layer. So how will you diagnose blood vessel slides? Look at the orientation of the tunica media. Thick tunica media, more than tunica adventitia, large-sized artery. Then the tunica media and adventitia is of same thickness, medium-sized artery or muscular artery. If the tunica adventitia appears to be the thickest layer, it is a large-sized vein. This is how you should actually identify the slides of blood vessels. Fine. So we will quickly revise. This is the slide of large-sized artery or elastic artery. Elastic artery is made up of three layers: tunica intima, tunica media, and tunica adventitia. Tunica media is the thickest layer. Tunica intima is made up of endothelium, subendothelial connective tissue, and internal elastic lamina. Internal elastic lamina is not distinct in elastic artery. The tunica media is made up of the wavy arrangement of 50 to 60 lamellae of elastic fibers. Right? Interspersed between this, we can get few smooth muscles, but the main component, remember, is the elastic fibers. The tunica adventitia is basically connective tissue, and this contains the larger blood vessels and nerves, which supply the blood vessel. The blood flowing through the lumen can only supply the initial part of the tunica intima, whereas rest of the area, the blood supply need to be supplied by the vasa vasorum. This is the large-sized artery or elastic artery. The medium-sized artery is identified by the presence of three layers again: tunica intima, tunica media, tunica adventitia. But the tunica media and tunica adventitia are of the same thickness. The tunica media is made up of smooth muscle layers, but more important than anything else, the internal elastic lamina is very prominent. How do we identify large-sized vein? Large-sized vein will also contain three important layers from inside out: tunica intima, media, and adventitia. The tunica media is small. Tunica adventitia is usually the largest layer. And what is the reason? The tunica adventitia contains longitudinal smooth muscle bundles which facilitate in the contraction of the venous wall and venous return. Are we clear? This is how you should describe and differentiate the three slides of the blood vessels. Even if you get one of this, the examiner will definitely ask you, how will you differentiate large-sized artery from small-sized artery or medium-sized artery? How will you identify large-sized artery from large-sized vein? And you should be ready with your explanation along with the examples. Are we clear? So this is the discussion of all the three slides of the blood vessels under 15 minutes. Now, please quickly revise and refer to the video that is there in the DocTutorial app, where we have done a detailed explanation of these blood vessels in the similar manner. So use it for revision whenever you need. Right? Now, we will close this session, but before closing this session, if you have any doubts, please feel free to ask. Right? Now, we will come back with another topic for next Tuesday, and that is for like long essay discussion, where we will discuss about the extraocular muscles. Right? Then in the next Thursday, we will come up with another 3 slides of general histology. We'll try to complete general histology, and once we do it, we will shift to the systemic histology slides. Thank you very much for joining. See you next week. See you on next Tuesday with the discussion of one more important long essay. Thank you.